Peace, everyone. This is Jahi Far, and I'm creating this video to go over and clarify some of the most misunderstood terms people may hear and run into when seeking the advice of healthcare practitioners, be it MD or ND practitioners. Okay, and those terms are acute versus chronic. Serving size versus therapeutic size or dosage, benign versus malignant, and allopathic versus naturopathic. Okay, so let's jump right into it. The first set is acute versus chronic. Okay, acute is any illness that comes on suddenly. So anything that you experience suddenly, it didn't take a couple of days to build up or a couple months to build up, you suddenly started coughing or you suddenly start sneezing, that is considered an acute cough or an acute sneeze. Or if you suddenly start feeling some pain right here and your arm wasn't already injured, then that's an acute pain right there. On the opposite end, you have chronic, and chronic is a degeneration of the body, of the systems, and it's done over time. It didn't come suddenly. It was some buildup. It was some workup to that particular illness that you may have now that is considered to be chronic. Okay, and it's worth noting that all chronic illnesses and diseases will eventually promote and lead to an acute illness and or disease. For an example, if a person is suffering from asthma, right, this person will eventually run into an asthma attack, which is the acute illness of that chronic disease and illness, asthma. Okay, so asthma attack is the result or the symptom of the chronic illness, asthma. Okay, very important to note. Same thing with high blood pressure. High blood pressure being the chronic illness, and a stroke or heart attack is the result or the symptom of that chronic illness, which is high blood pressure. So it's very important to note that. And this is important, very important, because if a health practitioner, such as a medical doctor or a natural doctor, gives you a diagnosis or an assessment that contain these terms, such as, okay, you have an acute circulatory system, or you have an acute illness, then you understand now that your health protocol is going to be different from an acute illness rather than a chronic illness. For another example of that, dealing back with asthma, if a person's having an asthma attack, which is the acute illness, then you would give them a different herbal formula to excite their respiratory system so they can take in as much oxygen as possible. So it's going to be like a shotgun formula just to heal them from that acute illness that they're suffering at that time. However, on the other end, if you're dealing with a chronic illness, which is asthma, then over time you want to not only deal with the lungs and making sure that the person is receiving enough oxygen, but you want to also make sure that the body is alkaline. You want to also make sure that the phlegm is being excreted and expended out of the lungs, off of the bronchial tubes, and out of the body. But that's a long-term formula that you will be taking. So the two ways that you would deal with an acute issue and a chronic issue would be totally different. So it's very important to know the difference if you're given an assessment or a diagnosis that's containing those terms, whether or not you have an acute illness or a chronic illness. I think that's very important in terms of being knowledgeable of your health. So moving on to the next set, which is the serving size versus the therapeutic size. Okay, a serving size is pretty much mandated by the Food and Drug Administration that all foods and foodstuffs should contain either some documentation or label accompanying that food to let the person know based off of the mandatory, not the mandatory, but based off of the default 2,000 calorie consumption per day, how many nutrients of this particular herb or food stuff that you'll be consuming. So, for an example, if you're eating, you're aware that when you buy food from the market, they have the serving size on the back, and of say for an example, if it's a pizza, and it may say the serving size may be 2 slices or a slice and a half, and that will always be based off of the 2,000 a day calorie recommendation for those nutrients that are contained within that pizza. The same thing for herbs. Most herbs will have a label on it that say, okay, take 2 capsules of this particular herb based off of the 2,000 calorie a day allowance of this particular nutrient. But that's only considered when a person is in a state of health already. The serving size is not based off of you trying to heal or rejuvenate the system. Okay, it's only based off of you receiving enough nutrients to accompany that default 2,000 a day calorie allowance. Okay, I hope that's clear, because to get the therapeutic dosage, you have to now go above and beyond the serving size, because you want to go beyond that just containing those nutrients to actually having those nutrients to heal and rejuvenate the organs and or systems of the body. So the serving size, again, is different from the therapeutic size, because the therapeutic size has to go above and beyond just the 2,000 calorie a day allowance of nutrients. It has to go above and beyond it to actually provide the healing effects that are warranted from taking the herbs. And I'm speaking just in terms of herbs. I have to reiterate that, because I'm not a medical doctor, so I can't speak about synthetic drugs, over the counter or prescribed drugs. I'm only speaking on herbal formulas and herbs, because they are, by the Food and Drug Administration, considered as foods. Okay, and again, in order to get the actual healing effects, you have to take the therapeutic dosage, and the therapeutic dosage is always as recommended by most holistic healthcare practitioners, is double the amount that you would see on the serving size. Okay, it's double that, because you want to, again, go above and beyond just having the nutrients, but you want to heal the actual either acute or chronic illness that you may be suffering from. So it's important to know those terms as well. Okay, so moving on to the next set, which is benign versus malignant. Benign versus malignant. Now, benign is pretty much seen as non-cancerous and non-dangerous. It's just given the denotion of benign, because it's letting you know, look, you need to start focusing on healing that body. For example, if a person has benign prostate hyperplasia, then that's letting you know you're having some overgrowth in your prostate and in your male reproductive region. So you need to start taking some steps to heal that issue and illness that's going on down there. The same thing with women when they have benign tumors or cysts on the uterus or ovary. And the assessment or diagnosis that's provided to them, the benign is just letting them know that, look, it's not cancerous, it's not as dangerous, but you need to start changing your lifestyle. You need to start doing something to stop these tumors and cysts from growing. Okay. On the other hand, is malignant, and 2 words to be associated with malignant: dangerous, cancerous. Dangerous and cancerous. Okay, malignant tumors, cysts, moles, blood pressure. It can be associated with blood pressure. It can be associated with a lot of different things. But when you hear malignant, know that it means dangerous and cancerous, simply because whatever it may be, tumors, cysts, moles, they can spread first and foremost, and then they are living off of carbon dioxide instead of oxygen, so it causes the body to be acid instead of alkaline, and then it degenerates the body rapidly. So it's very important that you take steps to get rid of and heal the body from those malignant either tumors, blood pressure, cysts, whatever you want to call it. Malignant is very dangerous. So it's very important to know the difference between benign and malignant. Okay. The last thing to touch on is allopathic and naturopathic. Allopathic is pretty much the Western way and modality of healing diseases and or issues that a person may run into. And some of those modalities are synthetic drugs, which suppresses the acute phase that you may be that you may be facing at that time, surgery, chemotherapy, radiation. They are the top modalities of the allopathic medicine, and they're pretty much practiced by MDs, medical doctors. Again, their focus is pretty much healing the actual symptom, which in most cases is just the acute phase. So they're not really concerned at the moment about healing the chronic issue, which is sometimes referred to as the root cause of the acute illness. Allopathic medicine is strictly focused on dealing with the problem that's facing you right now. And it's necessary in some cases. For example, if a person got shot by a gun, then in most cases, herbs take time to heal the body. Your blood is gushing out. You need to be soaked up. You need to stop that blood from actually gushing out. Same thing if you got hit by a car and you fractured your skull, you're going to need some surgery to actually help mend that skull back together. So allopathic medicine has its place, but again, it's pretty much its focus is pretty much for suppressing symptoms and or performing surgery and things of that nature. Okay. Not something that you want to be practicing for common colds, as I would recommend. Again, common colds, you would use the other portion of healing, which is the naturopathic way of healing, or the naturopathic modalities of healing, which is pretty much practiced more in the eastern part of the world. And their modalities consist of just lifestyle change in general. But to point out some of the specifics, exercise, yoga, stretching, very important for blood flow. Blood helps the body to heal from a lot of different illnesses. Also allows the body to oxygenate and alkalizes itself. Very important. But other things are, of course, herbs, natural herbs, which are food. The diet, what you're eating, will determine the outcome of your body. Very important. Acupressure, acupuncture, which is pretty much the same thing. One uses needles to help move the energy within the body. If energy is stagnant, it helps to move it. Same thing with acupressure, which is just the outside pushing on different meridians of the body. Homeopathics, which is a very minute synthetic drug, which will help the body to heal itself. Okay, homeopathics. What else? Chakra balancing, another good thing. It helps to balance the endocrine system. Very good. And naturopathic medicine or healing is the way to go, because it allows you to deal with the holistic person, the mind, the body, but also the spirit. It brings in all of those three beings. It doesn't separate them out. It knows that in order to heal from the chronic issues, which is things that happen over time, the degeneration of the body, you have to regenerate and rejuvenate the body. And that happens with the combination of the mind, body, and spirit totality, not just one. So again, the naturopathic medicine focuses on healing not just the symptoms, which it can do, but it focuses on the chronic issues as well. So I hope that was clear. I hope that I define and clarify some of those terms. Again, they're very misunderstood. When I'm talking to a lot of people, they say things such as malignant or benign, and not really understanding the terms of them, and also acute and chronic terms just being thrown out there, and people not really understanding the meaning of how it affects their health, and then of course the health protocol, what things you will do to actually heal from that acute or chronic issue that you're facing. Yeah, so again, I hope that the video has been insightful, has been helpful, and I hope that I clarified as much as possible the differences between those most misunderstood medical terms. As always, all comments, questions, concerns are welcome. Thank you for your time. Have a great and wonderful day. Peace.